Dr. Mark McBride here with Dr. Bear Total Body Healthcare. Spring is in the air, summer is right around the corner, and as the weather starts to change, so do the needs of my patients. One of the things that people start coming into the office for this time of year is foot pain, specifically plantar fascia pain. That pain in the bottom of the foot feels like a little gremlin stabbing you in the bottom of the foot when you wake up in the morning, you step out of bed and you're like, ah, right there? Yeah, that. Over the years, I've worked with lots of patients to help them with their plantar fascia pain. I have a great protocol. I'm going to take you through my protocol today and show you how I help my patients. I like to start by working on the muscles in the posterior portion of the knee, through the hamstrings. Sometimes we'll start up in the glutes, work down through the glutes, the hamstrings, behind the knee and into the calf. You'll find that individuals that are having that plantar fascia pain, that whole kinetic chain of that leg is dysfunctional. So you got to start at the top and work your way down before you even get into the foot. After we've worked on all the muscles above the foot, now it's time to get to the foot. Taking the Theragun and starting to break up those fascial adhesions in the inferior portion of the foot. After spending several minutes working the plantar fascia over with the Theragun, it's time to transition over to getting some mobility back in that foot. Then back to more Theragun work. Now that we've worked on the muscles throughout the leg, we've worked on the muscles throughout the calf, we've worked on the muscles in the actual foot, we've worked on mobility, it's time to break out the factor tools and start breaking up those fascial adhesions, the reasons that the foot is causing the pain. This will give the plantar fascia an opportunity to lay down a better base layer of material. For cases that are a little bit more stubborn and aren't responding as fast as what we would like, one of the things that we'll also add in addition to everything else that we're doing, but even more, is also adding in treatments with therapeutic ultrasound. Your first question probably is, how long is this going to take and how many visits? Visits are usually anywhere from 20 to 30 minutes when I'm working on plantar fascia cases. Everyone is unique and responds differently to treatment. Timetable and how many visits, each case is unique, but as far as timing and scheduling, what I like to do is be very aggressive with my treatment schedule with these cases. So I try and do 2 to 3 times a week with the patient for 2 to 3 weeks. With improvement of 2 to 3 weeks at that protocol schedule, then we start spacing visits out. So once per week, once per every other week. Once you kind of hit that point, they're in the clear. Like most cases with plantar fascia pain, there are setbacks. There's improvement, 3 steps forward, 1 step back, 2 steps forwards, 1 step back. Patients that have a noticeable improvement after the first visit have long-term success with this protocol. The goal is to get the patient back to doing the things that they're enjoying without pain in their feet. Also check out my video on how to tape a foot for plantar fascia pain. I hope this helped with your plantar fascia pain and on to a quick road recovery for you. Click subscribe for more health tips. When your body needs repair, visit Dr. Bear.